We came here and we did some field work. I think that's amazing because two foreigners came to UK and did some visits so much organizations including CCG and the local council. I think that's very interesting. We visit several institutions in Brighton, including the CCG, Clinical Commission Group, the Primary Care Trustee, such as the GP in St. Peter's Clinics, and also Health Watch is including kinds of socializations and the NHS system. And I found it's very interesting, the very concept about integrated healthcare. I think it's a new trend in England because currently it met austerity financial condition. So the NHS, the CCG, and the local council cooperate with each other more and more frequently and deeply. They are more and more welcome a proactive service approach, like they integrated the primary care, the community care, and the nursing care, emergent care, also some community works together. They want to keep the patients living in community at home as longer as possible. There's a kind of ways to reduce the burden of hospital. And I think this has a very good aspect because it's take the patient-centered. It's a holistic ways to give a patient a well-being in their homes. They use the community groups, community volunteers, and even neighbors to support people, especially the old people, support them and to make them live less lonely. I think it's a very valuable innovation. Even the motive of the innovation is tight budget. And I think it's a big transformation because we treat a person as a person instead of we treat them as a person whose need could be divided into separate parts and provided by separate department. In England, there is formal arrangements to carriers. It's very important here. But in China, we are family-based care system, and it's an informal sector. The government has a blind area to the family care. They are just the informal sector. And I think the informal care in China also met some challenging because of the rural to urban migration. The younger generation moved out of the rural areas and left the elderly people left behind. It became an empty nest elderly. So how to support the family to take care of the elderly is also a new challenging situation in China. Here we give so many support to the carriers, such as giving the loans, giving advice, the respect care. The local council and the CCG are joint commission to some organizations to support carriers in the family. And I think this is very good it can give a reference to China and can give some suggestions to the Chinese governments. I think in China, the traditional community is still there, and they could have some resources, traditional resources like neighborhood, like family, and I think they need much more formal support, like UK did here. Much more resources and much more budget could be put into community, I think. In China, we don't have general practitioner system here. And in China, we have a fragmented health insurance system. And anyone, and they see a doctor, they pay about 30 to 40% of out of pocket. So when they got ill, they can choose any level of health system. They can go to hospital directly. So when I got ill, such as me got ill, I go to see the secondary doctor, to go to the doctor in hospital. I don't choose the clinical doctors because their skills is not as good as hospital. It is a very serious issue because the large hospital is more and more crowded. It's lack of the human resources to meet the human needs of the citizens. And there are commissioners like CCG and local council, and there are provider organizations like we visit the Sussex Community Foundation Trust, the CareLink, the Community Work, and Brighton Hove Integrated Service Care Service. Sorry, and there are still supervisors like Health Watch and CQC. I think the whole system is a whole system. There are commissioners and providers and supervisors, and in China, many cities or many local authorities they try to make the public service procurement, and they try to practice a public service procurement. And there's something we could learn from this process, I think.
It's not a copy or transplanting the new system to another system. I think it's not well said, the transplanting this to that. I think in China, maybe we take in some new experience and root it in Chinese culture or political system. We should think the advantages of our own system, and maybe we should think disadvantages at the same simultaneously, because the informal sector has advantages to reduce the burden of the formal sector. I think in European welfare states, they has a large burden. They count back to the old days. I think we has in our country, in China, maybe we should has advanced vision to how to encourage informal sector to keep its healthy development. It's not to let them deteriorating in the long run. Maybe we should give some financial support. Maybe it's a very small budget. It's a small, but they can grow healthy in the future.